At the University of Illinois Urbana-Champaign, student Lainey Nelson struggled to excel in her courses after the pandemic hit. As a psychology major with minors in integrated biology and chemistry, most of her pre-pandemic classes were already challenging lecture-based courses. Here's Lainey on her experience taking all online courses when she returned to campus for the fall 2020 semester.
We came back to school and it started and all of my classes were online. I had an anatomy lab dissection online where they're asking us to find the different muscles. Think of that on blurry Zoom and them saying, you need to be able to do this for the test. And then every single practical, I couldn't see the pictures. So I would get like an F.
Lainey made the ultimate decision to take a year off from school and currently works at an urgent care clinic while studying for the MCAT. She is still on track to graduate next spring.
The other thing that's so hard about being in the pandemic with anxiety and with depression is that usually to the people around you, there's warning signs, but you can't see them now. Usually my friends would like kind of know something was wrong if I was sick a lot, like I didn't go out and I didn't go to my classes. But now it's just so much easier to just fade into the back.
For students currently enrolled in classes, mental health counselors can help. Here's psychotherapist Deborah Koopman on the ways students can alleviate their stress.
So I think it's really trying to decide in terms of coping mechanisms, trying to decide what is self-care versus like self-sabotage. For instance, if you do calm down by watching Netflix, say, watching one or two episodes of your favorite show is a good coping strategy, but binge watching it all night is not a good coping strategy. That's what I would call like self-sabotage. It's all that, how much am I doing a certain activity? Is it self-care, or am I doing it too much because I'm avoiding or I am sabotaging myself some way?
Though the vaccine promises an eventual end in sight to the pandemic, COVID-19 and safety measures have drastically affected the mental health of college students. Increased concerns surrounding the health of loved ones as well as difficulty adjusting to online classes has led to increased stress and anxiety in young adults.
The pandemic has presented us with something we've never dealt with before. Normally navigating transitions, there is uncertainty, but a lot of people have usually experienced them. What's been different about the pandemic is that we've never been in a pandemic. So it's hard to know how to navigate and get that support because a lot of times we don't have answers because there are no answers right now. So that's made this transition much more difficult.
For Lewis students, the Health and Counseling Center can help improve students' mental health. Throughout 2020, counselors met with nearly 300 student clients. Here's Jill Whitaker, Director of Counseling Services, on how appointments changed due to COVID-19.
The one significant thing that I noticed is that stress is the number one reason for seeking services now versus anxiety. But then once we kind of unpack things, we recognize that it's really some natural anxieties that are coming up with such a chaotic year and so many different kinds of pressures than we're facing.
While completing school has proved to be a challenge for students, there are resources for those in need of some help. The Lewis Health and Counseling Services is currently taking appointments and plans to host several Mindful Moments, Stay Up, and Pathways events throughout the month of March. For LUTN, I'm Emily Krivigrad.